if you are somebody who knows you have PCOS, you're married, you're trying to conceive, for PCOS patients and women over 35, we normally give them about 6 months, try, then come. Let's see if we can help you, because for a baby, for fertility, I'm a fertility person, so I'll always digress that direction. You want a baby, the sooner always is better. The younger you are, the easier it is for your fertility specialist to assist. So if you know you have PCOS, or you suspect you have PCOS, so if you have somebody just say you have any of the symptoms we've talked about, you have irregular cycles, you have strange acne that you use all sorts of creams and you've been all over the place and nothing
and it's
is
not
helping.
going away.
Maybe try seeing a gynecologist who may just be able to figure this out for you. You have excess hair in interesting places. Just come and see a gynecologist, and we should be able to help you. So and this is my plea to all women, not just those with the PCOS. From a fertility perspective, the sooner the better.
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA, SHIF, UHC change that, or is there more? Or perhaps, what's the difference between a pharmacy with a Blue Cross and a Green Cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more?
Women's health, men's health, your children's health, the economy, this and more awaits you on season 2 of Kenya's favorite health podcast.
My name is Dr. Diana Wangari-Gitau, and welcome to season 2 of the One Health Lens podcast.
Hi, good morning to you. How are you doing? I hope you've had a lovely week. You're having a lovely day. My name is Cheryl Blessing, and this is the One Health podcast, the explained edition, where we get more into detail about some of the health conditions that we're dealing with, some of the health terms and things that are in the market, whatever facilities are being opened up, and whatever resources are available to us. And today I want us to focus on a condition that is called PCOS. This is something that affects most ladies that I am aware of, but I want to talk to Dr. Maureen Owiti, who is in studio here with me, so she can give me more detail on what PCOS is, who it affects, how we can manage the condition. Karibu.
Thank you so much, Cheryl. It's a pleasure to be here.
It's such a pleasure to have you here. And we were having another conversation about preeclampsia, and now we're getting to PCOS. And I'm aware that PCOS affects some of my friends who are ladies. And I'm just wondering, could you give us a breakdown of PCOS? Does it affect both male and female? What is PCOS?
I don't know how we managed to choose diseases that were only affecting women. But I guess mine should be seen as a gynae. So, and especially the reproductive tract. So, PCOS, I think, is just an acronym. I don't know if saying polycystic ovarian syndrome will make it any better, but it's a disease. I always tell my patients that as doctors, we're very interesting people. We like going on holidays. But we have fancy name for going on holiday tonight at conference.
Medical conference, Mombasa.
So our Europe, they had met in a place called Rotterdam. So Rotterdam is in the Netherlands. And therefore we have something called the Rotterdam criteria for diagnosing PCOS. And to the best of my knowledge, that is what we're still currently using. So for someone to say they have PCOS, they have to have one of 3 criteria. So the actually 2 out of the 3 major criteria, so major and minor, but we just concentrate on the major nowadays. So the first major criteria is they have irregular cycles. So in the irregular cycles, you find a woman. Normally, the PCOS patients, they have cycles that are more than 45 days. So 2 months, 3 months, 4 months, a whole year. Hajaona period. you can imagine.
Yeah.
And I think for the rest of us who have normal periods, the first thing I think, hey, mimba.
What's going on? Exactly. That's the first, especially if you're not like on any contraceptive or anything. I can imagine the worry if it's the first time that you're experiencing that.
Yeah.
You'd even think you're like a Virgin Mary or something.
So so we call that oligomenorrhea or amenorrhea. So that means they have few cycles. So in fact, the regular cycles is those ones that they have few cycles.
Yeah.
So in a year, you have 12 months. They'll have less than 12 cycles in a year. So that's the first one. The second one is when we do an ultrasound, there's a classical finding we find on the ultrasound, and we have diagnostic criteria, and we call that polycystic ovarian morphology on ultrasound. So ovaries normally are roundish, ovalish.
Yeah.
And we have follicles spread throughout the ovarian tissue. So in the classical picture, you find we have follicles. They are arranged neatly around the periphery of the ovary. And in the middle, where we call the stroma, there are no follicles there. So the old saying, in fact, some of the things I give my students spot diagnosis.
Yeah.
And they're supposed to tell me pearl necklace appearance.
Nice.
So if you see how pearl necklace, so it looks like a pearl.
It's just perfectly layered.
Yes.
Yeah.
So that's what we call, that's the classical polycystic ovarian morphology. However, there are variants, but those who are trained on do the ultrasound know what criteria they're supposed to use to say that this patient has polycystic ovarian morphology on the ultrasound. So that's the second major criteria. Then the last is clinical or biochemical signs of androgen excess. Just a fancy term of saying that features showing she has more male hormones. Okay? The most common male hormones would be testosterone or androstenedione, but I think we all know testosterone. So let's just say they have high testosterone levels.
Yeah.
So when we say clinical, so we can check their blood and their testosterone, their male hormone levels are normal, but they have features that are telling us that you have excess male hormones. So the most common complication I get, women coming are one of two, but the most common is acne.
Yeah.
So they have a lot of acne, especially on the face. Yeah. So acne, by the way, can be due to excess male hormones. Other are also common, but not as common, but would be a complaint, is what we call when they have excess hair. So you have like a mustache.
No, that's because of the excessive male hormone in the system. Yeah.
And this, so we have patterns of male hair. So you can see, like women, we normally have very scanty kidogo, short hair on the arms. Then unajua vile ya mwanaume,
imeja,
you can get, so a lady is having that type of pattern. Even like on the abdomen, normally women, our hair doesn't grow upwards on the lower abdomen. You have that type of clinic in feature in a woman. Then there's balding. So, there's women, they bald, recede.
So it can happen.
Yes. Or unapata mwanamke anaongea na bass. Hi, how are you? Have a very deep voice, because I mean most women have a higher pitched voice. Yeah. So it's not saying that all the women with deep voices
are suffering from PCOS. I know. Mtene kaanze kujishuku. No, you have to have multiple symptoms for you to be classified as someone who has PCOS.
Yeah. And even that, so the clinical term for the excess hair, we call that hirsutism. So we have a way of measuring. We have several scales of measuring, and depending on the severity, we can classify. So then we have to also look for other things that can cause all of this. So like, for example, not having the period can be because maybe you have thyroid problem. So investigate for a thyroid problem. So you have no other thing you can attribute these symptoms to. So when you have 2 out of these 3, and you really can't find another cause for this, that's when we say somebody has
PCOS,
the PCOS, PCOS, polycystic ovarian syndrome.
And it's so fascinating the way you're talking about it, because this is some of the things that probably someone will notice. You skip maybe a month of your periods and you think, I don't know what happened, but I'm good. Especially people who are not sexually active. And if you have some of these other symptoms, you'd probably be wondering, why do I have excessive hair? Why do I have this? Why do I have that? But you do not understand that there's an underlying condition that is causing all that. Now, is there a treatment for PCOS?
Okay. So I would say yes and no. So for polycystic ovarian syndrome, mostly what we do is manage the symptoms. We don't know exactly what causes it.
Yeah.
We do know it's a metabolic condition. So what I'd liken polycystic ovarian syndrome to would be the hypertension, what we call essential hypertension, or diabetes. So you find those diseases, when we diagnose, we manage the condition. We're not able to, it's not like malaria.
Yeah,
you give an antimalarial and you get cure for malaria.
Yeah.
So we just manage the disease
and
that. But the difference with polycystic ovarian syndrome, though we are now seeing it still has impact even after menopause. So you find, for example, your issue was periods are irregular. See, when you go into menopause, you're not going to get them at all. So however, it's very important that I'm saying this, that women who are diagnosed with polycystic ovarian syndrome are at higher risk of getting all those other issues associated with age. So things like actually diabetes, hypertension, they're very at high risk of getting that. So it's good that someone's able to get a diagnosis, so they're able to look after themselves and start managing, so that they also minimize effects of those diseases, because any disease, it's how long you've had it and how severe your symptoms are that are going to affect. Now you find something like both diabetes and hypertension are things, I don't know, even there's something like preeclampsia today. It will affect your kidneys. They both can affect your kidneys. They can affect your eyesight. They can affect almost all
the major organs,
systems in your body. So it's good sometimes that somebody's able to have that, so we're able to do lifestyle modification. One, to, if we're not at all going to stop them developing those diseases in the future, at least mitigate complications of those diseases.
And you talked about having some lifestyle changes to help, because it's related to the metabolic system. So what are these lifestyle changes that you can incorporate? Is it, let's say I was a bit overweight, if I cut some weight, is it going to maybe reverse the effects of this condition? Or if I take up a more healthy lifestyle, because in this day and time it's very difficult for people to maintain healthy lifestyles. We have the convenience of cars, Ubers, bikes if I don't feel like walking 100 meters, and even the food that is there, the diet is not as healthy as we should have. So if I amend some of those lifestyle things, can I reverse the effects of the condition?
Okay, so very interestingly, I'll say yes, but it's also a challenge. So I'll say, for example, as I've said, the most common reasons we see women in the clinic is 3 issues. It's their periods, acne, hair. Those are the most common. The other common is for married couples, when they don't have a baby. These women, some of them, not all, can have a challenge in conceiving. So those would be the major things that we do manage with patients with PCOS. So if I look at obesity, you find those who are able to lose weight, they notice when they lose weight, their periods now start coming regularly. You understand? And they start ovulating, because there's some association that those women who have PCOS, they chronically do not ovulate. So most cycles, they're not ovulating. And that's why you're getting that. Remember that we talked about that pearl necklace appearance? It's like all the follicles are remaining the same size, because the normal cycle You're supposed to have those follicles come up, then they grow under the influence of some hormones.
Yeah.
What you call I don't want to use conk terms. And when it's ready, it ovulates. So you find that pattern is not being done. So these ovaries, follicles just stay the same size.
Yeah.
And they give you that picture on the ultrasound. So, but when they lose weight, you find they start ovulating. And if you start ovulating, remember we said the periods are irregular.
Yeah.
And they're not able to have a child.
Yeah.
They're able to
so
ovulate.
it increases your
They're able to conceive.
Yeah.
They're able to conceive. But herein lies the crux of the matter. PCOS, you find weight loss sometimes can be very challenging in this group of women. So they're not like those people like, most people say mokianza gym, mokianza diet, and the weight sheds off.
Yeah.
And they find it a bit harder than an ordinary person to lose weight. So it's easier said than done. So sometimes they do need to see us. Some of them do need to be given some extra medication to help them on the weight loss journey. But but for all patients, we'll always start with the first. So who are very important people in the life of a PCOS patient. So a nutritionist is very important to help them with diet modification.
Yeah.
And I think we're in the era where we're not talking about that restrict garden. It's just when to eat and the quantities to eat at the right time. And obviously exercise. Exercise, I tell women, you don't have to go to the gym necessarily. Something as simple as a brisk walk, 30 minutes. Okay. Now, brisk walk will be me and Cheryl tunaenda hapa paka, I don't know what, tuende to the park na round moja ama kumi around the park. And we're trying to talk. So the way right now, because we're seated, we're able to talk very comfortably. We can still be able to talk, but you find there'll be a bit of
out of breath.
Out of breath. So that would be what we call a brisk walk. 30 minutes. And that should be adequate. That should be adequate.
And when you're talking about that, though I've told you, I have some people within my circle who are experiencing PCOS. And I know one deals with severe acne. The other is also experiencing like hair loss right now. And, it comes with some low self-esteem with the weight gain. I think I've seen that in both of them. And also with the medication that they're under, it also makes them gain some weight. So the condition can come with someone feeling like I'm less feminine, or, I'm not as confident as a woman. I'm not feeling like I can step out and be bold and confident. So how do you deal with that in your patients? How do you encourage them and tell them, it doesn't matter. This condition is present, yes, but it doesn't stop you from living your full life.
Okay. So again, as I said, so I'm not familiar with the treatment they are on. But every patient comes in, we really try to explore what are their main concerns. Okay?
Yeah.
So is your main concern acne? Is your main concern your period? Is your main concern you want a baby? And then we now say, okay, to achieve this, probably these are the options that we can try. So it's really understanding. I like that we call them treatment options.
Yeah.
There's no one size
fits all.
You understand? And you can try this. It worked for patient X, but it's not working for patient Y.
Yeah.
Okay. So I feel as healthcare providers, our role is just to keep the patient motivated, tell them there's hope. And just give them hope, because for me, reasonably, we are able to assist a vast majority of patients. It's just you find they achieve something, they stop treatment, go back to,
and it relapses.
Go back to square one. So it's life, and I'll tell them, even people who are not dealing PCOS, there's no one who doesn't have insecurities.
That's true.
It's life. We all deal with
we all struggling with one thing or the other.
So It's just how to identify what their primary issue or issues are, and how to help them to overcome them. Yeah. So, but life is a struggle, and every day, new challenges come, and it's just how to keep facing those new challenges.
And it's very, very fascinating that you're expressing that. It's a case by case thing where you observe a particular person. If you want to have a child, then you deal with that. If you want to lose weight, then you deal with that. If it's acne, so it's not really medication that's prescribed generally. When you're with malaria, all these other conditions, if it's a flu, antibiotics. Now remember to a story, Meisha. But with this, you have to really customize and figure out. So you've said you can't cure PCOS. You can only manage PCOS. Can it have any further complications? Because you've talked about when it comes to like menopause, when you're giving birth, or when you want to give birth. Are there any other challenges that come about with the condition?
Okay. So, as I've said, and interesting, both for menopause and even in pregnancy, you find women with PCOS would have a greater propensity to develop even preeclampsia or gestational diabetes. So gestational diabetes is the diabetes we get just during the pregnancy. In fact, one of the ways of diagnosing is those women who do have gestational diabetes, just follow up. You can find out quite a number of them may have polycystic ovarian syndrome as well. Again, later on in life, these are women who are more likely to now develop proper diabetes or hypertension. But other than that, I wouldn't say they have other severe complications.
Which is something I think that's good news, because fortunately we're also in a day and age where the medical field has advanced, and these are things that can be controlled with diabetes, hypertension. People live with them and they're okay, and for the most part with the right maybe doctors and professionals helping you out, then you can manage long term, and it shouldn't affect your quality of life that much. And I think
I'd also just like to mention at this part that not all women with PCOS need to be on treatment. Okay. And what I like, you find, and it goes by all diseases. Your first option is to do nothing.
And let your body do the work for you.
Having had said that, if you do nothing, it means we're going to be at square one, and other complications may come in. But for example, if somebody was worried her only outward symptom is that she's not getting the periods, there's nowhere those periods are hiding that's nangojea kukuja
all at once.
Inakuwa infected. Those are some of the fears they have that
there's something truly wrong.
Imebaki huko ndani hazijatoka or something like that. So if that's just that, if that's the concern and they understand that they have the PCOS, we don't necessarily need to bring the cycle every month. But if it's a big concern, it's affecting them, we're able to give them medication that will be able to give them the cyclical periods. Again, I think one of the biggest concerns, one of the biggest misconceptions I get from women with PCOS, they all feel, I'm not going to have a baby. And I would like to tell them I have many clients with PCOS who have conceived by themselves without any intervention from us healthcare providers. But having had said that, it's not the story for everybody. So don't say, doc said I can conceive by myself.
They'll follow you and say,
like
Dr. Maureen, you lied.
Yes, So it's just understanding that if you are somebody who knows you have PCOS, you're married, you're trying to conceive, for PCOS patients and women over 35, we normally give them about 6 months, try, then come. Let's see if we can help you. Because for a baby, for fertility. I'm a fertility person, so I'll always digress that direction.
Yeah.
You want a baby, the sooner always is better. The younger you are, the easier it is for your fertility specialist to assist.
Yeah.
So if you know you have PCOS, or you suspect you have PCOS, so if you have somebody just say you have any of the symptoms we've talked about, you have irregular cycles, you have strange acne that you use all sorts of creams and you've been all over the place and nothing
and it's
is
not
helping.
going away.
Maybe try seeing a gynecologist, may just be able to figure this out for you.
Yeah.
You have excess hair in interesting places. Just come and see a gynecologist, and we should be able to help you.
Yeah.
So, and this is my plea to all women, not just those with the PCOS. From a fertility perspective, the sooner, the better. So, agreed. Nowadays in our consultation room, we meet very interesting women.
Yeah.
Women have changed. Not everybody wants to have a family.
Yeah.
So I say, if you're that group, you feel you're very clear, your brief in life is very clear, you don't want to have a family, you don't want to have children, sawa, probably not for you, this conversation. But if you feel somewhere, at some point in your life, you would like to have a baby, I would tell women, please, let's do this earlier, preferably before 35.
Yeah.
Because a lot of women imagine, they're concentrating on their careers, so they're getting PhDs, I don't know what, which is good, and I would really support women to do that.
Yeah.
But I say, school professors, we've done a very good job in helping women plan for their professional life. But I'm like, for me as somebody who has family, I think one of the most important areas of your life is family. Nobody helps you plan one of the most important areas of your life.
Never. Family planning is just something that you have to seek for yourself.
You understand?
Yeah.
So I tell women, I'd like to save women from themselves. So if you want to have a family, plan for it earlier. There's nowhere saying that having a baby is or having a family will stop you from doing other things. I don't like using myself as an example, but I don't want to confuse people. I was able to go through postgraduate, get married, and have 2 children,
which is wonderful. I think that's a wonderful example.
And I thank God that I didn't have to stay extra time. The department was very supportive, so I was able to finish with my class who I started with. And even if you are to stay behind, it's 1 year, 2 years, and you're done. So there's nothing saying that you can't do career and profession at the same time. Having had said that, you can become a professor at 80 if you so wish.
That's true.
You understand? You cannot naturally become a mother, and I don't think it would actually be a right thing to become a mother.
That's by miracle.
And that's me obviously giving an extreme condition. Again, it's one of the debates we have as fertility people of how old is too old to become
a mother.
I say, you know what, the most intelligent person I know in this planet, okay, maybe I don't know them personally, but is God. And God said menopause anywhere between 45 and 55. So I'm like,
there's a limit.
If God says it's supposed to be in menopause at 55, why are we stretching it, Sana?
That's true. And I think that's I think, because time is also lapsing, that's wonderful advice. I really love that, because so many young ladies, we need to hear that. Because we are pursuing our careers, we're doing all these things, and we try to figure out, how am I going to balance my work and then having a baby? But it's possible. Based on your example and based on countless other women that we have seen, it's something that's doable. It's something that we should consider, particularly if you have a good man, you're ready to settle, you're ready to start that chapter in your life. That's something to consider. So I think the takeaway from this conversation, my personal takeaway, is just have a gynecologist, just so that you can know. In case there's anything, you can advise, and they can really custom make treatments for you. In case of any condition, it's very easy for your gynecologist to administer treatment or advice because they know you personally. So we need you, Dr. Maureen, clearly. We're going to be at your door after this conversation. Yeah.
But,
thank you.
And especially for anyone who feels she has any of the symptoms for the PCOS, I'd really encourage them to see a gynae.
Yeah.
And we see if we can help figure it out. Also scared. Maybe you don't have PCOS.
Maybe
even just being told that, you'll feel better.
I know. Maybe in stress your life. I think that's wonderful. That's a wonderful place to end this conversation at. So I hope you have gotten something from this talk, and we'll have so many more conversations regarding your health and how to make it better. What are things that we can do? What are the treatments that we probably need that we're not aware of? But have a gynae. If you're a lady, if you're a gent, see a doctor. Just regular doctor's visits are very, very beneficial to us. That's it. I'll see you next time. We'll have another interesting conversation. But for today, I think that's a wrap. My name is Cheryl Blessing, and this is the One Health Lens podcast, the explained edition.